This month, in our continued partnership with the Maine Cancer Foundation and Challenge Cancer 2020, we show you how healthcare workers are connecting communities with life-saving services.
WMTW News' Lauren Bradley sat down with the people leading the charge. The city of Portland launched a project a few months ago to reach the underserved communities and get them screened for colorectal cancer. Tonight, we show you how that program works.
If you wouldn't mind giving me a call back.
Brendan Johnson spends a lot of time on the phone. As a community health outreach worker for the city of Portland, he's trying to track down more than 200 people who could be at risk for colon cancer.
My whole point of being here is try to help make people healthier, try to make sure we catch cancer if they have it.
According to the CDC, colon cancer is the second leading cause of cancer-related deaths in the United States and the third most common cancer among men and women. That's why there's a big push to reach those low-income minority communities who have trouble accessing preventative care.
It's not easy to navigate a healthcare system when you're coming from a different country and when you're trying to get a new life.
Lots of things get in the way. People don't have insurance or a way to get to doctors' offices.
Quite honestly, there are very few barriers that can't be broken down. There are a lot of resources in this town. It's typically a matter of knowing how to access it.
Maine Cancer Foundation gave the city of Portland a $100,000 grant to hire 6 workers like Johnson. Each one speaks the same language as their assigned patients, allowing for more direct and tailored care. Johnson works with the English-speaking group. He explains to patients the benefits of getting a colonoscopy or a FIT test. That's when people send in samples of their stool, and the results are available within just days.
We're reaching a lot of people who are being educated about colorectal cancer screening that didn't know a lot about it before. And we're also getting a lot of people to commit to colonoscopies or the FIT tests.
He says so far it's been a success, but he knows he's got more calls to make.
It's important to me to give them that opportunity, and being able to see some of these people reach out and take it.
Program coordinators say they're constantly evaluating the program, what works and what doesn't. That way they can make improvements. Reporting in the studio, Lauren Bradley, WMTW News 8.